Asthma affects millions of people around the world, turning something as simple as breathing into a daily challenge. But recent research suggests that asthma is influenced by more than just the lungs. Asthma is a chronic inflammatory disease of the airways, where the tubes that carry air in and out of our lungs become swollen and narrowed. When triggered, these airways tighten, produce mucus, and block airflow. Common symptoms include shortness of breath, wheezing, chest tightness, and persistent coughing, sometimes building slowly or suddenly turning into an asthma attack. Triggers can be anything from dust and pollen to smoke, cold air, or air pollution. And here's the thing, over 4.6 million people in Canada are living with asthma, but with the right treatment, it can be managed. But if asthma can be treated, here's the real question. What happens when people can afford the treatment? Asthma treatment usually includes two types: controller medication that prevent inflammation and reliever inhaler that treats symptoms quickly. In a study by Dr. Kate Johnson in British Columbia, researchers looked at what happened when a 2019 policy made asthma medication free for low-income patients. They analyzed data from over 97,000 patients, comparing medication use before and after the policy. The results shows that people use more medication overall, especially the important controller inhalers, meaning treatment became more appropriate. However, even though access improved, adherence didn't change much, and health outcome didn't fully improve. So, cost is a real barrier, but removing it alone isn't enough. But even when treatment became more accessible, what if the real risk is the air you breathe? Researchers analyzed over 1,800 studies to understand how long-term air pollution exposure affects asthma risk in adults. The results shows that fine particle, the tiny pollutant from sources like smoke and pollution, has the strongest and most consistent link to developing asthma. They also found that traffic-related pollution was associated with a higher risk, highlighting the impact of urban environments. So asthma could be closely related to the environment we live in. In the end, asthma isn't just about breathing. It's about the condition that makes breathing harder. And to truly improve outcomes, we need to look beyond the lungs.